Live. This is News 8 at noon.
Welcome back to News 8 at noon. I'm Lisa Carberg. Today marks the official one-year mark of the World Health Organization declaring COVID-19 a global pandemic. Hard to believe. This morning, Trinity Health New England held a ceremony at St. Mary's Hospital in Waterbury to remember those who have lost their lives to the virus and to honor the work of healthcare workers who've been on the front line since the beginning.
My patients. Sorry. My patients, I remember them all. I remember their room numbers, their names, their faces.
And while coronavirus was bringing Connecticut to its knees, we really had no idea how the story would progress and how our lives would change in the subsequent months. Here to reflect on the past year is Dr. Patrick Troy. He is a pulmonologist with Hartford HealthCare. Doctor, welcome.
Thanks for having me.
Thanks for being here. So looking back at 2020, how has this past year compared to your other years as a doctor?
Well, I would definitely say it's been memorable, that's for sure. I don't think when I went through medical school at the University of Connecticut, they ever mentioned a pandemic in my future. So it's certainly been life-altering, I think, both for myself, my partners, and for all of Hartford HealthCare, quite frankly.
All right. What surprised you about the virus and how it all evolved?
That's a great question. I think the reality was it was kind of like we were sitting around and we saw this. It's like watching a storm come, and you figure, oh, okay, it's coming. We'll batten down the hatches. We'll get ready. We've had bad flu seasons before, for instance. But what was different about this was the rapidity, the escalation, how quickly we went from just a couple of cases to literally inundated with cases. And then sort of the realization that this wasn't going to go away. This wasn't going to be a phase or a season. This was with us to stay at some level until things got better. So it was a real adjustment in mindset in terms of getting ready for that longer battle, struggle with this.
Great description. All right, let's talk about your colleagues. How have they been coping in the past year? You guys have been on the front lines seeing a lot of death.
That's the hardest part, right? If you had to ask me sort of what's the hardest part about this, I think myself and my colleagues would hands down just sort of talk about the loss of life. And it's not just loss of life, it's how the life was lost. Sometimes in the beginning, almost feeling helpless. And sometimes these patients, because of the restrictions that we had to put in place, were there without their family. And that took a heavy toll, I think, on a lot of us. And so what we did was pull together as a family, as doctors and advanced practitioners and nurses, just to support each other through this, because it's hard if you haven't walked in this to know what it's like and what it's been like.
Great description again. All right, quick last question. What lessons have been learned about how the virus has been handled?
So the one thing I want to stress is that our competency in how we deal with this virus is excellent right now. We know the tools and techniques that we need to use, and people talk about let's getting back to normal. I'd like to phrase it a little bit differently. What we've learned is going to allow us to do what our CEO at Hartford HealthCare says, it's a better than normal. We're going to use some of the hard lessons to position ourselves so that we care for people better than we ever have. So not normal, better than normal. That's where we're headed.
I love that. That fits right about where we are right now with some hope on the horizon. All right.
Optimism.
Dr. Patrick Troy, thank you so much for joining us.
My pleasure. Thanks for having me.
Thank you.